Cardiovascular diseases, CVDs, are the world's leading cause of death, claiming an estimated 9 million lives each year. This alarming statistic underscores the critical need for greater awareness and proactive measures. CVDs encompass a range of disorders affecting the heart and blood vessels, such as coronary heart disease, cerebrovascular disease, and rheumatic heart disease. More than 80% of CVD deaths are attributed to heart attacks and strokes, with a significant portion occurring prematurely in individuals under the age of 70. The primary behavioral risk factors driving CVDs include unhealthy diet, lack of physical activity, tobacco use, and harmful alcohol consumption. Environmental factors like air pollution also play a significant role in exacerbating these diseases. When individuals consistently engage in these risky behaviors, they often exhibit intermediate risk factors such as elevated blood pressure, raised blood glucose levels, high blood lipids, and increased body weight, conditions that can be detected and monitored in primary care facilities. These markers signal a heightened risk for heart attacks, strokes, heart failure, and other severe complications. One of the most effective strategies to combat the rise of CVDs is through lifestyle modifications. Quitting smoking, reducing salt intake, consuming more fruits and vegetables, engaging in regular physical activity, and avoiding harmful alcohol consumption have all been proven to lower the risk of developing cardiovascular diseases. In addition to individual actions, health policies that promote supportive environments are crucial. These policies should aim to make healthy choices more accessible and affordable, improve air quality, and reduce pollution, thereby encouraging people to adopt and maintain healthier lifestyles. Beyond prevention, identifying and managing those at highest risk of CVDs is vital. Ensuring that individuals have access to appropriate treatments and interventions can significantly reduce the incidence of premature deaths. Primary health care facilities should be equipped with essential non-communicable disease medicines and basic health technologies to provide necessary treatment and counseling. This holistic approach, combining both prevention and effective management, can substantially lessen the burden of cardiovascular diseases globally. In conclusion, the fight against cardiovascular diseases requires a multifaceted approach. By addressing behavioral and environmental risk factors, supporting policies that foster healthy living environments, and ensuring access to essential medical care, we can make significant strides in reducing the global impact of CVDs. A collaborative effort from individuals, communities, and governments is imperative to prevent and manage these life-threatening conditions, ultimately saving millions of lives each year.
What are the symptoms of cardiovascular disease? Cardiovascular disease symptoms can vary depending on the cause. Older adults and people assigned female at birth may have more subtle symptoms. Symptoms of heart issues: chest pain, angina, pressure, heaviness or discomfort, sometimes described as weight on the chest, shortness of breath, dizziness or fainting, fatigue or exhaustion. Symptoms of blockages in blood vessels throughout your body, pain or cramps in your legs when you walk, leg sores that healing, cool or red skin on your legs, swelling in your legs, numbness in your face or a limb. This may be on only one side of your body, difficulty with talking, seeing or walking.
There are many types of cardiovascular diseases involving the blood vessels. They are known as vascular diseases: coronary artery disease, coronary heart disease or ischemic heart disease, peripheral arterial disease, a disease of blood vessels that supply blood to the arms and legs, cerebrovascular disease, a disease of blood vessels that supply blood to the brain, include stroke, renal artery stenosis, aortic aneurysm. There are also many cardiovascular diseases that involve the heart: cardiomyopathy, diseases of cardiac muscle, hypertensive heart disease, diseases of the heart secondary to high blood pressure or hypertension, heart failure, a clinical syndrome caused by the inability of the heart to supply sufficient blood to the tissues to meet their metabolic requirements, pulmonary heart disease, a failure at the right side of the heart with respiratory system involvement, cardiac dysrhythmias, abnormalities of heart rhythm, inflammatory heart diseases, endocarditis, inflammation of the inner layer of the heart's endocardium. The structures most commonly involved are the heart valves, inflammatory cardiomyopathy, inflammation of the myocardium, muscular part of the heart, eosinophilic myocarditis, Inflammation of the myocardium caused by pathologically activated eosinophilic white blood cells. This disorder differs from myocarditis in its causes and treatments. Valvular heart disease, congenital heart disease, heart structure malformations existing at birth, rheumatic heart disease, heart muscles and valves damage due to rheumatic fever caused by streptococcus pyogenes, a group A streptococcal infection.
Curious about heart disease risks? You're in the right place. Let's dive in. Heart disease isn't just about bad luck, it's a mix of factors. Age is a biggie. Your risk triples with each decade. Genetics also play a role. Some people inherit risky genes, but don't worry. Most heart diseases involve many small genetic tweaks. Lifestyle is huge. Smoking, eating junk food, and sitting around all day? Not great for your heart, but there's good news. Exercise, a balanced diet, and cutting out cigarettes can flip the script. Conditions like high blood pressure, diabetes, and high cholesterol also up the ante. If you've got these, managing them can make a world of difference. Then there's sleep and stress. Poor sleep and lots of stress? Bad combo. Aim for 7, 9 hours of sleep and find ways to chill out. Finally, watch out for air pollution. Living in smoggy areas isn't just bad for your lungs, it harms your heart too. Remember, while you can't change your age or genes, you can change your lifestyle. Small steps lead to big changes. Stay heart smart, folks.
Ever wondered why managing heart disease doesn't have to break the bank? Today, we'll uncover affordable tips and treatments. Cardiovascular disease. Sounds scary, right? But guess what? It's totally manageable. First up, diet and lifestyle changes. Think balanced meals, regular exercise, and quitting smoking. A healthier you means a happier heart. And here's a tip. Get your flu shot. It can reduce heart attacks and strokes. Cost-effective treatments are our best friends here. For heart attack prevention, aspirin and atenolol cost less than a movie ticket. More intense treatments like TPA are pricier but necessary in some cases. Surgery can be a lifesaver too. Valve replacements, pacemakers, and coronary angioplasty are just a few options to keep your heart in rhythm. And remember, going overboard on lowering blood pressure might not add extra benefits. So, there you have it. Heart disease management made easy and affordable. Stay heart smart, folks.
Hey there, health enthusiasts. Today, I'm diving into something crucial: diet tips and treatments for heart disease. If you're looking to boost your heart health, stick around. First up, diet. Your heart loves a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Think Mediterranean diet, packed with good fats like olive oil, nuts, and avocados. It's not just about what you eat, but how you eat. Smaller frequent meals help maintain steady blood sugar levels, crucial for heart health. Now, let's talk about what to avoid. Cut down on saturated fats, trans fats, and sodium. These culprits are known to raise bad cholesterol and blood pressure. Swap out that processed junk food for something wholesome. Your heart will thank you. All right, on to treatments. If diet and lifestyle changes aren't enough, medication might be necessary. Statins are the most common prescriptions for lowering cholesterol. They work by blocking a substance your body needs to make cholesterol. Blood pressure medications like ACE inhibitors and beta blockers can help manage hypertension. Don't forget about antiplatelet drugs like aspirin, which prevent blood clots. Always follow your healthcare provider's advice on these. There's also some exciting new treatments on the horizon. Gene therapy and advanced surgical techniques are paving the way for better heart health outcomes. Keep an eye out for these innovations as they become more mainstream. Finally, let's not forget the role of exercise and stress management. Regular physical activity, such as brisk walking or swimming, strengthens your heart and lowers stress. Mindfulness practices like yoga and meditation can also do wonders for your heart. So, to recap, eat a balanced diet, avoid harmful foods, consider medication if needed, and embrace new treatments and lifestyle changes. Your heart is in your hand.
Today I'm diving into a super important topic: how to prevent cardiovascular disease through essential screening tips. Cardiovascular disease is a leading cause of death worldwide. But the good news is, it's preventable. First off, let's talk about the importance of regular checkups. Visiting your healthcare provider at least once a year for a full physical examination is crucial. These appointments help track your blood pressure, cholesterol levels, and heart rate. Early detection can be a game changer in preventing severe issues down the line. So, what screenings should you focus on? Number 1, blood pressure measurement. High blood pressure often has no symptoms, so regular monitoring is essential. Aim to keep it below 120/80ths mmHg. Next up, cholesterol tests. High levels of LDL cholesterol, the bad kind, can lead to plaque buildup in your arteries. Get a lipid panel test every 4-6 years if you're an adult. If you have risk factors, get tested more often. Don't forget about blood sugar tests. High blood sugar can damage your blood vessels and nerves, increasing your risk of heart disease. If you're over 45 or have risk factors like obesity or family history, get tested for diabetes regularly. Another key screening is the electrocardiogram, or ECG. This test records the electrical activity of your heart and can detect irregularities. It's especially important if you have symptoms like chest pain or shortness of breath. Now let's touch on prevention. First and foremost, maintain a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Limit your intake of saturated fats, trans fats, and sugars. Exercise regularly. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity each week, plus muscle strengthening exercises twice a week. Stay away from tobacco. Smoking is a major risk factor for cardiovascular disease. If you smoke, seek help to quit. Manage stress. Chronic stress can take a toll on your heart. Practice relaxation techniques like meditation, yoga, or deep breathing exercises. And finally, get enough sleep. Adults should aim for 7-9 hours of quality sleep per night. To wrap things up, remember that early detection and lifestyle changes can make a significant difference in preventing cardiovascular disease. Stay proactive about your health, and you'll be on the right path to a longer, healthier life. Cardiovascular diseases are a group of disorders that affect the heart and blood vessels. These diseases can lead to serious problems like heart attacks and strokes. They are often caused by unhealthy habits such as smoking and a lack of exercise. Understanding cardiovascular diseases is crucial because they pose a significant threat to global health. Cardiovascular diseases encompass a range of conditions, including coronary heart disease, cerebrovascular disease, and rheumatic heart disease. Coronary heart disease affects the arteries that supply blood to the heart muscle. Cerebrovascular disease affects the blood vessels supplying the brain. Rheumatic heart disease is a result of damage to the heart valves caused by rheumatic fever. These conditions can lead to a variety of complications, including heart attacks, strokes, heart failure, and other serious health issues. Heart attacks occur when blood flow to the heart is blocked, while strokes happen when blood flow to the brain is interrupted. Heart failure is a condition in which the heart cannot pump blood effectively. Cardiovascular diseases are the leading cause of death worldwide. Sadly, they claim millions of lives each year. This global health crisis affects people of all ages and backgrounds. The World Health Organization estimates that cardiovascular diseases are responsible for more deaths than any other cause. The impact of these diseases is felt worldwide, with significant variations in prevalence across different regions. While Africa has a relatively lower burden of cardiovascular diseases compared to other continents, the reasons for this difference are complex and multifaceted. In 2008 alone, cardiovascular diseases accounted for approximately 30% of all deaths globally, highlighting the immense toll these conditions take on human life. The impact extends beyond mortality, as cardiovascular diseases also contribute significantly to disability and reduced quality of life for millions of individuals. While cardiovascular diseases affect people globally, low- and middle-income countries bear a disproportionate burden. Sadly, these countries often lack the resources to effectively prevent and treat these conditions. Factors like poverty, limited access to healthcare, and unhealthy lifestyles contribute to the higher prevalence of cardiovascular diseases in these regions. Many people in these countries lack access to basic healthcare services, including regular checkups, essential medications, and timely interventions. The lack of awareness about risk factors and prevention strategies further exacerbates the problem. Furthermore, limited access to healthy foods and opportunities for physical activity contribute to the development of cardiovascular diseases. Section 4. The looming cardiovascular crisis. Alarmingly, experts predict a significant rise in cardiovascular deaths by 2030. This projected increase is a cause for serious concern, particularly in low and middle-income countries where the burden is already high. Several factors contribute to this concerning trend. These include population growth, aging populations, and the increasing prevalence of risk factors such as obesity, diabetes, and unhealthy lifestyles. As the global population ages, the number of people at risk of developing cardiovascular diseases is expected to rise significantly. Additionally, the global rise in obesity and diabetes, often linked to unhealthy diets and sedentary lifestyles, further fuels the projected increase in cardiovascular deaths. Section 5. A closer look at South Asia. The South Asian subcontinent faces unique challenges related to cardiovascular diseases. The region has witnessed a dramatic increase in these conditions in recent years, posing a significant public health threat. Genetic predisposition coupled with lifestyle factors such as high carbohydrate diets and a lack of physical activity contribute to the high prevalence of cardiovascular diseases in South Asia. The region's rapid urbanization and changing dietary habits have also played a role in the increasing burden of these diseases. Moreover, limited access to quality healthcare and a lack of awareness about prevention and early detection further compound the problem in South Asia. Addressing this growing health concern requires comprehensive strategies that focus on both prevention and treatment. Section 6. The fight for heart health, a call to action. Organizations like the Indian Heart Association are working tirelessly to combat cardiovascular diseases in the region. These organizations play a crucial role in raising awareness, promoting prevention, and improving access to care. Through public awareness campaigns, educational programs, and advocacy efforts, they strive to empower individuals to make heart-healthy choices. Their work encompasses promoting healthy lifestyles, early detection, and timely intervention strategies. However, a concerted global effort is needed to effectively address this growing health crisis. Governments, healthcare providers, and individuals must work together to promote heart health and reduce the burden of cardiovascular diseases worldwide. This includes investing in research, improving access to healthcare, and promoting healthy lifestyles. Everyone has a role to play in the fight against cardiovascular diseases. By raising awareness, adopting heart-healthy habits, and supporting organizations dedicated to this cause, we can make a difference in combating this global health threat. Thanks for tuning in. Don't forget to like, subscribe, and hit the notification bell for more health tips. See you next time.